So, good afternoon. We're going to start talking about pharmacology. And pharmacology is described as the study of medications as they affect the body. There are some things you should know about pharmacology. First, drugs do not create any new function. They only enhance and or decrease an existing function. So, what does that mean? Well, if you cannot dance, you cannot take a medication that's going to make you dance. If you cannot sing, if that is not something that you already can do, you cannot take a medication that's going to make you suddenly start to sing. However, if you are a good singer, there may be some things that you can do that will either enhance your existing ability to sing. What's another thing we need to talk about when we're looking at pharmacology? There are some basic considerations for the actions of drugs. First, we need to think about the onset of action. What does that mean? When you take a medication, how soon will I start to see the medication? In most instances, the effect of the medication usually occurs within 30 minutes after taking the medication. What about peak action time? Peak action time describes the time when the medication is at its fullest amount in the body and giving you your full effect. The peak action time may be anywhere from 1 hour to even 3 to 4 hours, depending upon the medication that you are taking. The peak action time can also be one of the most concerning times for the patient as well as the practitioner. It is at the peak action time because of the large amount or the greatest amount of medication um, circulating in the body that you may see some of the side effects. What is the duration? The duration of a medication talks about how long that medication is going to give you a desired effect. Again, many medications will vary in duration time. Let's look at Motrin or Tylenol as an example. On the Tylenol bottle, it tells you to take 1 or 2 tablets every 4 hours. The 4 hours that they're discussing is the duration time. When will you expect to see the length of time that you are going to get the desired effect from that medication? The therapeutic effect, that's our next concept to look at. The therapeutic effect is the desired effect of that med. The therapeutic effect often tells you what the medication is designed to do. For example, if you're taking a medication for high blood pressure, the therapeutic effect is it's a decrease in blood pressure or hypotension. Sometimes the therapeutic effect can be multifaceted, meaning that you can get several different kinds of therapeutic effects from one particular medication. Let's look at aspirin for an example. When a client is taking aspirin, aspirin often gives you a therapeutic effect of pain relief, but also aspirin can cause the client to have bleeding. And in some cases, especially during a cardiac arrest or cardiac incident, having the blood being anticoagulated can be a desired effect. So, what's a side effect? A side effect is an undesirable effect of that medication. Sometimes I tell students that the side effect is a therapeutic effect gone wrong. Let's look at antihypertensives again. If a client is taking a medication to lower their blood pressure, that is the therapeutic effect. But a side effect could be that the blood pressure is lowered too low. So again, your therapeutic effect can be an over exaggeration, confirmation of a therapeutic effect. Let's look at the duration of act or factors that may influence a drug's action. The client's weight, for example. Depending upon the weight of the client, it can cause the practitioner or provider to either increase or decrease that medication. The client having different kinds of chronic diseases can also influence the therapeutic action of a med. For example, if the client has kidney failure, they may not be able to excrete the med. Or if they have poor circulation, they're not going to be able to distribute the med. The environment is also a factor, a risk factor in drug action. In the environment, if it's too hot or too cold, it could destroy the medication, change the chemical composition of the med, and cause that med to become less effective. Administration timing is also a factor in drug action. Certain medications work faster than others. And the psychological status of the patient is also a factor in the therapeutic action of a drug. If a person truly believes this medication is going to work for them, they're more likely able to see therapeutic effects. This is the end of my sample presentation.